Hello, everyone. I hope you all are doing well. As ma'am has already introduced me, I'm Mishita Gupta, a trauma-informed psychologist and a clinical hypnotherapist with over 3 years of experience working in the mental health field. Before I begin, I would like to thank my mentors and everyone present here for giving me this beautiful opportunity to share my learning and clinical experience through this case. I'll be sharing a case study on the application of hypnotherapy in treating health anxiety. So please give me a second. I'll present my screen. Um, is my screen visible, ma'am?
Yes, it is visible. Just make full screen. Yes, perfect.
Okay.
Yeah.
Yes. So we'll begin with a case introduction. The client is a 35-year-old female. She has been married for 6 years. And when she came to me after she uh, after the birth of her son, after 1 month of the birth of the son. And the client reported that whenever she experienced even a minor physical symptom, such as chest pain, gastric issue, body pain, or any unusual sensation, um, she would immediately fear that something serious was happening to her health. So she often described thoughts such as, what if something happens to me? Or what if this is a serious illness? तो जब वो मेरे पास आए थे तब उसका 4-5 मंथ्स इसकी सिवियरिटी बढ़ गई थी। ये कोविड के बाद से हेल्थ रिलेटेड उनको एंजाइटी डेवलप होने लगी। Although the anxiety it was present since the COVID period, but last 4-5 months से काफी ज्यादा हो गई थी. So the fear was not limited to her own health. She also experienced a considerable amount of anxiety regarding the well-being of her child. What was particularly interesting about this case was that prior to COVID, the client had lived independently for almost 9 to 10 years and had never reported any significant health-related anxiety. So, this suggested that the anxiety was not lifelong in nature, but appear to develop after COVID or after series of stressful and health-related life events. So now we'll understand the development and the maintenance of her health anxiety. So we'll move to the next slide. Okay, so here are her presenting concern. At the time of intake, the client was experiencing severe health anxiety, so minor physical sensations such as gastric discomfort, chest heaviness, or body pain would trigger catastrophic thoughts about serious illness or death. So she reported that what if I'll not be there, who will look after my child? So she also used to frequently monitor her bodily sensation. She used to search symptoms online. She used to read about it in detail. और जैसे हमारा फोन का एल्गोरिथम वर्क करता है, हम जो सर्च करते हैं उससे रिलेटेड कंटेंट ज़्यादा हमें मिलने लग जाता है। तो उनको उस रिलेटेड रील्स, यूट्यूब पे वीडियो, इंस्टाग्राम पे रील्स, सब कुछ इसी हेल्थ रिलेटेड आने लग गया था. So she used to seek reassurance from others, and she found it very difficult to tolerate uncertainty regarding her health. So the anxiety was causing significant emotional distress, and it also extended to her child's health and safety. So एग्जाम्पल्स इंक्लूड हर सो उस टाइम पे उन्हें लेफ्ट हैंड पेन स्टार्ट हो गया था। दैट कुड बी क्योंकि बच्चे को उठाना होता है तो इतना हैबिचुअल नहीं होता है। सो इट कुड बी दैट। सो पर उन्होंने इस पेन को शी इंटरप्रेटेड टू द फियर ऑफ अ हार्ट अटैक and chest discomfort due to gas. So she after giving birth she was also diagnosed with gastritis. तो जब भी stomach discomfort होता था that leads to her anxiety, and then constantly checking with others about whether she might be having a heart attack despite normal health reports. So these were her presenting concerns. We'll move to the next slide where we'll explore history and triggering events. Okay, so this started, as I've already mentioned, that this started during COVID. So what happened was client and her husband were living alone in Delhi, and both of them got infected while they were alone. So during that time, the client experienced breathing difficulties, and she remained awake throughout the night, monitoring herself, and then constantly looking after her husband also, since both of them were alone. कोई भी सपोर्ट नहीं था, एंड द रिकवरी ऑल्सो टुक अ सिग्निफिकेंट अमाउंट ऑफ टाइम। उनकी हेल्थ काफ़ी ज़्यादा अफेक्ट हुई थी। एंड ड्यूरिंग दैट टाइम क्योंकि न्यूज़ में आसपास बहुत सुनने में आ रहा था डेथ्स हो रहे थे, तो दैट ऑल्सो एडेड टू हर फियर। And during COVID, her maternal uncle also died. So this appears to be a major emotional turning point that strengthened beliefs such as serious illness can happen suddenly, or health problems can quickly become life threatening. And after COVID, she also got to know that somebody known to her had heart attack, and this also added to her triggers. So she thought every time she experienced chest pain, she thought she would get a heart attack. Then so this fear it got increased after she got to know about her mother-in-law's pancreatic cancer. So this happened last year. So the client came to me in 2025. um, and last year, she got to know that her mother-in-law has been diagnosed with pancreatic cancer, and this again reinforced her belief about severe illness and vulnerability. Then another triggering event was uh, pregnancy complication. So after 1 month uh, of after 1 month when she conceived, uh, she spotted bleeding during her 1 month, within 1 month of her pregnancy. So the doctor advised bed rest due to miscarriage risk. तो डॉक्टर ने बहुत जनरल सेंस में बोला था कि इट्स वेरी नॉर्मल, ब्लीडिंग स्पॉट होती है, तो आप 2 मंथ्स तक बेड रेस्ट लीजिए आराम से। पर उस ड्यूरेशन में क्लाइंट का एंजाइटी काफ़ी बढ़ गया था, बिकॉज वो फियर आ गया था, व्हाट इफ आई लूज माई बेबी। और जब वो बेड रेस्ट पे थे तब 2 मंथ्स तक उन्होंने रिपोर्ट किया कि काफ़ी ज़्यादा एनजाइटी हुई थी, काफ़ी ज़्यादा थॉट्स लूप में चले थे। और उसी ड्यूरेशन में शी गॉट इन टच विथ, आई फॉरगॉट टू मेंशन हियर, शी गॉट इन टच विथ अ रेकी मास्टर, also a counselor. So she was receiving energy healing from him, and also she used to talk about her concerns. She reported that this helped her a lot. तो जब वो मेरे पास आए थे तो ऑलरेडी 7 to 8 मंथ से वो उनसे हीलिंग ले रहे थे, और काउंसलिंग भी वो उनकी कर रहे थे। Yes, and after delivery, the child he got sick, and the child required hospitalization. So this further intensified worries regarding health and safety, adding on to her triggers. And then again, she was also diagnosed with piles. That In that duration, her gastric symptoms got increased, and she reported weight loss of approximately 6 to 7 kg. That again increased monitoring of bodily sensations. So this was overall history and triggering events. काफी मैं brief में ये बता रही हूँ because PPT है, so couldn't write more. We'll move to the next slide. Yeah. So we'll go through the case conceptualization. Um, so we'll see what was maintaining her cycle. So physical sensations were there. Gastritis की वजह से उनको stomach discomfort रहता था, chest tightness, heaviness, pain, dizziness भी रहता था, fatigue रहती थी. So she there were symptoms of postpartum depression as well. So the client's central fear appears to be like, if something feels wrong in my body, it may be a sign of a serious illness and something terrible could happen to me. And during that time, उन्होंने काफ़ी सारे डॉक्टर्स को बताया, उन्होंने अपना ईईजी कराया, सारा हेल्थ चेकअप, उन्होंने फुल बॉडी चेकअप करवाया, सब कुछ नॉर्मल आया था. उनको डॉक्टर ने भी बोल दिया था कि ये आपको साइकोलॉजिकल हो रहा है, सो यू सीक हेल्प फ्रॉम अ थेरेपिस्ट. पर उनको समहाउ सेटिस्फैक्शन नहीं होता था, बिकॉज जब भी बॉडीली सेंसेशन होता था, अगेन इट यूज टू ट्रिगर हर थॉट्स एंड कैटास्ट्रॉफिक इंटरप्रिटेशन, that what if it is a heart attack, what if something serious is happening. सो वापस से उनका एनजाइटी बढ़ जाता था, अगेन फिजिकल सिम्टम्स उनके इंक्रीज हो जाते थे. देन शी यूज टू गूगल सिम्टम्स, शी यूज टू सीक रीअश्योरेंस. और इस टाइम पे उन्होंने अपने एक फैमिली डॉक्टर, न्यूरोलॉजिस्ट को दिखाया था. उनके कज़न ही थे, तो उन्होंने उन्हें इलनेस एंजाइटी डिसऑर्डर का डायग्नोसिस दिया था. उन्होंने कहा था कि इट्स नॉट रिलेटेड टू न्यूरो थिंग, यू कैन अगेन सीक हेल्प फ्रॉम अ साइकोलॉजिस्ट. सो this entire thing created a self-perpetuating cycle. Then we'll go through the protective factors. क्योंकि उनका काउंसलिंग हुआ था, तो इंसाइट उन्हें आ गई थी अबाउट द प्रॉब्लम, बट अगेन शी वाज नॉट एबल टू, just give me a second, somebody, yes, she was not able to help herself, क्योंकि फीलिंग लेवल पे कुछ और हो रहा था, इंटेलेक्चुअली उनको अंडरस्टैंडिंग थी, इंसाइट थी. उन्हें ये एक्नॉलेजमेंट था दैट द फियर्स आर लिंक्ड टू हर एंजाइटी. अगेन सपोर्टिव मदर. तो क्लाइंट जब आए थे तब वो अपने घर पे रह रहे थे, उनकी डिलीवरी के जस्ट बाद. वो अपनी मदर के पास ही थी, तो काफ़ी सपोर्ट मिला है उनकी मदर से. और घर पे भी सब हेल्प करते थे, तो एक सपोर्ट सिस्टम उनका था, क्योंकि हस्बैंड के साथ इट वाज जस्ट हर हस्बैंड एंड दे वर ऑल अलोन. सो मदर की तरफ से सपोर्ट मिला था. देन शी वॉज वेरी विलिंग टू सीक हेल्प. उन्होंने ये चीज़ कहा था कि मैंने साइकेट्रिस्ट को भी दिखाया है, बट आई डोंट वांट टू रिलाई ऑन मेडिकेशन. आई वांट टू हेल्प माई सेल्फ, आई वांट टू वर्क ऑन दिस थिंग कॉन्शियसली. सो दिस वॉज अगेन अ प्लस पॉइंट. फिर वो एनुअल हेल्थ चेकअप तो वो कराते ही थे, तो उनका हेल्थ कॉन्स्टेंटली इट वॉज ऑलवेज इन चेक. Then we'll move to therapeutic goals. So these were the short-term goals. So focusing on reducing physiological arousal, इमोशनल रेगुलेशन की काफ़ी ज़्यादा ज़रूरत थी. सो आई फोकस्ड मोर ऑन इमोशनल रेगुलेशन, देन reducing symptom checking and reassurance seeking. So these were the short term goals that I kept in mind. Long term goals were resolve fear linked to COVID experiences, increase psychological flexibility, develop trust in body's resilience, and reduce health related catastrophizing. So these were the goals, temporary goals that I decided at that point of time. We'll go through the therapeutic process. So, in the initial phase of therapy, my primary goal was to help the client understand what was happening to her rather than immediately trying to eliminate the anxiety. Although the client was aware that she might be overthinking, and she remained highly fused with her fearful thoughts. Whenever she experienced a physical sensation such as chest heaviness, gastric discomfort, or pain in her left arm, or restlessness, she automatically interpreted it as evidence that something serious might be happening. So I therefore begin with psychoeducation regarding anxiety, health anxiety, and mind-body connection. So we explored how anxiety can create genuine physical sensation. This helped normalize some of her experiences. Then I have not mentioned over here, but I also incorporated CBT techniques by helping her identify the anxiety cycle. So together we explored how a physical sensation would trigger a catastrophic thought, such as what if I get a heart attack? So this would increase anxiety, which again intensified the physical symptoms, leading to further fear. Then Googling the symptoms, reassurance seeking, and body monitoring. So, mapping the cycle helped her understand how anxiety was maintaining itself. So, my goal was that once she developed awareness of this pattern, I will then introduce ACT principle. So, rather than arguing with every anxious thought, I helped her arguing or dismissing every anxious thought. I helped her learn cognitive diffusion skills, which comes under ACT principle, acceptance and commitment therapy. So, for example, instead of saying I am having a heart attack, I asked her to begin reframing the statement, such as I am noticing the thought that I might be having a heart attack. तो यहाँ पे मैंने उन्हें डिफ्यूजन सिखाया कि कैसे वो अपने सेंस ऑफ सेल्फ को उस थॉट से अलग करके देख रहे हैं, और इससे उन्हें क्या हेल्प मिल रही है. So this shift allowed her to observe thoughts as mental events rather than facts. Then another focus was acceptance of uncertainty. So she frequently sought certainty about her health through medical consultations. I never stopped her from going for medical checkups. I asked her, आपको जितना मेडिकल चेकअप कराना है आप प्लीज करवा लीजिए. आई वॉन्ट यू टू बी फुल्ली सेटिस्फाइड. सो उन्होंने मेडिकल कंसल्टेशन करे थे. देन अगेन सो उनका सिम्टम चेक करना, ऑनलाइन सर्च, इन सभी चीज़ों में आई नेवर आस्क्ड हर डायरेक्टली to stop doing this. We rather explored how absolute certainty regarding health is not possible, and that the constant search for reassurance was actually maintaining the anxiety. So I also encouraged present moment awareness so that she could bring attention back to her current experience rather than becoming um, preoccupied with future based fears. So here I also introduced pranayam, Brahmri pranayam, and then Nadi Shodhana, which is alternate nostril breathing, and Brahmri pranayam is humming bee breath. Then Om chanting, AUM, Om chanting. देन योग निद्रा. सो आई आस्क्ड हर कि आप सोने से पहले योग निद्रा करेंगे, एंड एनी टाइम ऑफ द डे यू आर फीलिंग स्लीपी, यू कैन डू योग निद्रा. तो यहाँ पे मैंने प्राणायाम और योग निद्रा इंट्रोड्यूस किया था. ऑल्सो मैंने उन्हें ऑडियो रिकॉर्डिंग दिया था ब्रीदिंग अवेयरनेस का. सो दैट ऑल्सो आई हैव आस्क्ड हर टू प्रैक्टिस. तो ये मैंने उन्हें बोला था आपको कंटिन्यूअसली करना है फॉर एटलीस्ट 2 weeks. Then moving to values exploration. So fine, we explored important values in her life, including motherhood, her family relationships, and her professional role. So this helped shift the focus from fear-driven living to value-driven living. So the outcome of this phase was that the client began recognizing that her thoughts are not facts, and the anxiety was influencing the way she interpreted bodily sensation. So this was the phase one. It took around 3 to 4 sessions for this phase. Moving on to phase two. Um, at the time of so my focus before moving to any deeper therapeutic work, I felt it was important to first stabilize the client's nervous system. So at the time of intake, the client appeared to be functioning in a uh, near constant state of physiological arousal. So she was highly vigilant towards bodily sensation. uh, so I therefore introduced hypnotherapy primarily as a stabilization tool during this phase. So one of the first technique used was a progressive muscle relaxation. The purpose was to help the client become aware of the difference between tension and relaxation within her body. So, through systematically tensing and relaxing different muscle groups, she learned how much chronic tension she was carrying, and uh, experienced a reduction in physical arousal. So, she reported that she felt this sort of relaxation after a very long time. वो ऑलमोस्ट भूल गई थी कि रिलैक्स फील करना क्या होता है. Then, alongside PMR, I also incorporated guided relaxation, safe place imagery. And within hypnosis, the client was guided to create a place where she felt completely secure, calm, and protected. Uh, this became an internal resource. तो मैंने उसमें suggestions insert करे थे that she could access whenever anxiety intensified between sessions or once she move out of the session. तो उसमें मैंने settings भी include करी थी कि वो अपने घर में और with her child, then after she'll move back to her job. तो ये सारा settings मैंने include किया था इसमें. Then breath regulation. So in one of the session, I did breath work with her, or this really helped her because after breath work, उन्हें guided relaxation वापस से करवाया था. तो with the breath regulation, she was able to go in a much deeper state. So breathing, by breath work, I do not mean breathing regulation. So breathwork is a technique that is used when a person is experiencing psychosomatic symptoms. So it helps to release bodily emotions, whatever the emotions the body is carrying. Then this phase also it helped improve her responsiveness because she reported this to the Reiki master. So he's the one who referred her to me. So he reported me that she is being very positive about whatever you are doing with her, and she's really happy. She always look forward for your session. So it was a very positive feedback, and This actually prepared the client and her state of mind. Yeah. So the outcome of this was that the physical tension was reduced. Uh, uh, she was feeling emotionally settled and more capable of managing anxiety when it arose. So she also developed a greater sense of control over her reactions to bodily sensation. Uh, this again took 2 to 3 सेशन क्योंकि सेशन में उनको ये सब ब्रीदिंग
ठीक है वो काम दे दीजिए।
सॉरी
थैंक यू।
हेलो मैम एम आई ऑडिबल
Yes, yes. Someone by mistake, someone unmuted.
ओके
That's the
नो
reason.
प्रॉब्लम
You
नो
are on.
ओके moving on to phase 3. So in phase 3 I introduced ego strengthening. um, so this phase, although the client understood her anxiety intellectually, but she continued to perceive herself as vulnerable and at risk. और रिपीटेटिव थॉट पैटर्न रहता था, लूप में थॉट्स उनके होते थे. सो कॉन्फिडेंस इन अ बॉडीज एबिलिटी टू कोप विथ द इलनेस एंड रिकवर फ्रॉम डिस्कम्फर्ट, इट got significantly reduced over the years. And repeated experiences also contributed. As mentioned earlier, COVID infection, then loss of her uncle, her mother-in-law's cancer diagnosis, then relative getting a heart attack, then her child's hospitalization. So these everything was contributing. And again, it reinforced her belief that health problems were dangerous and that she needed to remain constantly alert to prevent something bad from happening. So during hypnosis, I used ego strengthening suggestions focused on themes such as inner resilience, ability to cope with uncertainty, trust in self and body, and emotional stability. So I focused more on this. So, for example, I encouraged her subconscious mind to recognize that she had already overcome many challenges in her life, including living independently for many years, then recovering from COVID, navigating a difficult pregnancy, and above all, she was still taking care of her child. Uh, then, so these were the points for ego strengthening. I particularly focus more on helping her develop greater trust in her body. So over time, उन्हें acceptance आ गई थी. She stopped fighting with her bodily sensations. Um, then the outcome of yeah, one more thing that I've missed. Our future-oriented suggestions were also incorporated, helping her imagine herself responding calmly and confidently to situations that would previously have triggered anxiety. So the overall aim was to help her move from position of fear and helplessness to one of confidence and self-efficacy. Uh, so the outcome was that her confidence in trusting her body's ability to cope it was increased, and reduced helplessness. And she also reported feeling more emotionally stable and less overwhelmed by uncertainty, which indicated that she had developed a stronger foundation. Um so this was the work I did, and ego strengthening was done twice. I did with the same, following the same script. So it was done twice with her, which actually helped in giving better results. And then I also provided her with the audio recording. Then moving on to phase 4. After establishing sufficient emotional regulation and strengthening the client's sense of self or internal resource, I moved to working on with the root cause. So in this phase, so despite normal health report and repeated reassurance from healthcare professionals, the fears still persisted. So it suggested that the anxiety was being driven not simply by present day symptoms, but by unresolved emotional experiences, uh, जो इतने टाइम से बैक टू बैक हेल्थ रिलेटेड स्ट्रेसर्स चले आ रहे थे. I used age regression and affect bridge techniques. I guided the client to explore earlier experiences connected to the emotional intensity she was currently feeling. One of the most significant memories that emerged was her COVID infection. During that time, since she experienced breathing difficulty, and she described that she used to remain awake, so she was unable to cope up with that because that duration was extremely difficult for her because there was no support, and her husband was also isolated in another room, so she remained hypervigilant, constantly checking on him. So this experience created intense feelings of fear, helplessness, uncertainty, and responsibility. Another emotionally significant event was death of the maternal uncle during COVID. Uh, Again, this also came when she was in the trance state, when she was deep into her subconscious. So we explored this memory, and it became evident that it had reinforced the belief that health crisis can suddenly become life-threatening. Additional experiences that emerged was her mother-in-law's cancer diagnosis, then her relative getting heart attack. So through guided reframing, we explored the idea that her hypervigilance had originally developed as a protective response. Um, because that period was a genuine period of threat. So, however, all the threat had passed, the protective response had remained active. So, the goal was not to erase the memories, but to reduce the emotional charge attached to them and help her update the meaning she was giving to them. So over time, the client began recognizing that her current bodily sensations were often triggering old fear responses rather than indicating actual danger. Uh, then, moving on to phase 5, reframing and reprocessing. So, after identifying the significant memories contributing to her health anxiety, my next step was to reframe and process, because that helped her to identify how it was contributing as a stressor, or arousing anxiety in her. This phase, so the client had, by now the client had gained awareness regarding her fear, and how she was aware how she was responding to the bodily sensation. So it became evident that again, experiences such as COVID, breathing, and loss of her uncle, it all contributed. So these conclusions included beliefs such as illness is dangerous and something bad can happen at any time, and I must remain constantly alert in order to feel safe, or in order to protect myself from any upcoming threat. So while these beliefs were there, it may have served a protective function during periods of genuine certainty and threat. I again, constantly, I was putting this in her subconscious. I used to repeat this every time I had a session with her. So within the hypnotic state, I also explored by asking questions such as, what did this experience teach you? And what meaning did you make from this event? So, as the client reflected on these experiences from her present day perspective, we begin by challenging the conclusions. This again helped her consciously, उन्हें वो on a conscious level, it helped her a lot. But deep down, that fear still persisted. So, for example, we also explored the idea that fear, again, it had been serving as a protective mechanism. We explored this in a trance state as well. Then a central theme of the reprocessing work was helping the client distinguish between past threat and present reality. So, as a result, the emotional intensity associated with these memories began to reduce, and the client reported feeling less emotionally overwhelmed. This was the work that I did in phase 5. Every phase, it took approximate 3 to 4 sessions. Then moving on to phase 6. So, yes, as I mentioned, the fear was still there. So, although she demonstrated significant improvement through psychoeducation, through CBT, ACT framework, relaxation training, then ego strengthening, uh, pranayam, but I observe that the fear, it every time in the session she used to mention कि मुझे इधर जब पेन हुआ था तब मुझे ये thought आया था. So I figured that the fear is still there. So then from so why I did ego state was because I wanted to work on that particular part which was carrying the fear. So from an ego state perspective, I conceptualize this not as resistance but as a again protective part that had developed during a period of threat. So, using ego state work, I invited her to connect with the fearful part rather than fight against it. This work, I did it through her conscious, but subconsciously, I did using ego state therapy. So, as we explored this part, uh, it became clear that its intention was not to harm her. I asked her if she is ready to accept that part, and she was very much receptive. So, this fear part appeared to believe that if I stopped monitoring symptoms, something terrible might be missed. So therefore, it continued to scan for signs of illness and activate anxiety whenever physical sensations were noticed, and then again physical sensations were causing anxiety. So rather than attempting to eliminate this part, I validated its protective intention and acknowledged the role it had played during difficult periods. And then once a rapport was established with this fear-based state, I facilitated dialogue between fearful part and the healthy adult self. So the adult self was encouraged to recognize that while the fear part had been helpful during periods of threat, the actual circumstances were difficult. The current circumstances were not difficult, I'm sorry, different. So the client now had access to medical care. I turned this into a positive frame that she has access to all the medical care. She has a support system, and then she again her body is still trying to help her a lot. So we've worked toward helping this part shift from being an alarm system that reacted to every sensation to becoming a supportive and appropriately protective part of the personality. So the goal was integration rather than elimination. This helped her a lot. This was the uh, major turning point in the therapeutic progress. Then moving on to the outcome. So the outcome was that she reduced googling symptoms. She instead of fighting with it, she tried accepting and understanding what those symptoms were trying to indicate. So observing sensations without immediate interpretation. Then she continued relaxation exercise. This again, as reported by her, it helped her in her emotional regulation was getting better. Although the anxiety was there, but now she was able to cope with that. So she was feeling confident enough that yes, I can handle it now. And increased awareness of anxiety pattern, reduce fear intensity, um, improved ability to challenge catastrophic thoughts, and this again increased confidence in managing bodily sensation. So this case is still ongoing. तो इस केस का ड्यूरेशन 1 ईयर हो गया है, तो फ्रीक्वेंसी सेशंस की ऐसी रहती थी कि महीने में 2 सेशन ही मैनेज हो पाते थे. So I used to give a lot of work to her. And that actually helped her, because then I used to constantly keep a check on her if she's able to do it or not through text message, because her baby was there, so she was not able to make time for the session frequently. And yes, abhi last 2 months से session नहीं है, because she has reported that she's able to manage well, और अब एकदम से वो alarm response नहीं होता है. So this was the outcome that I observed. We'll go through the clinical reflection. So the presenting issue appeared to be health anxiety. However, exploration revealed unresolved fear, grief, helplessness, and trauma responses originating from the COVID experience and subsequent health-related stressors. So integrating ACT, I did little bit of CBT with hypnotherapy, allowed both cognitive flexibility and emotional processing, resulting in a more comprehensive therapeutic outcome. Uh, this was the overall case presentation. I might have missed few points. But thank you all for your valuable time and attention. I hope this presentation provided useful insights. And please feel free to ask any question or share your feedback. I would love to listen to you. May I stop sharing the screen now?
Yes.
Okay.
Yes. Dr. Alok sir. Sir, unmute yourself. Sir, unmute yourself. So you are on
It was a
mute.
very presentation. I enjoyed the presentation. Nice. Nishita,
Thank you.
very good. Congrats.
Thank you, sir.
Anyone else has any question to ask, please? Yes. Oh, someone, I believe. Anyone would like to ask any question? Meena ma'am?
What was
Dr. Madhu?
yes, what was done in breath work?
Yes.
Okay. So I used different breathing techniques. I used to make her practice in the session itself. So I used to start with, for example, I used to start with long inhalation and exhalation. Then again, on a count of two, inhale on count of two, exhale on count of two. Then I moved to 4-4-4, that is box breathing. Then again, uh, I moved towards rapid breathing, that is continuous inhalation and exhalation without break. So I used to make her do this in the session. So this helped her a lot, क्योंकि उनको difficulty हो रहा था even when she was doing. So when you do continuous inhalation and exhalation, ऑक्सीजन ज़्यादा पहुंच रहा है ब्रेन में, राइट? तो उन्हें उससे डर लग गया कि मेरा दिमाग फट तो नहीं जाएगा. So, but then I helped her during throughout the session, and at the end of the session, she felt really better, and she was like, "This is something really new. I've tried this for the first time, rapid breathing," and आई आस्क्ड हर कि मैंने उन्हें ये पर्सपेक्टिव भी दिखाया था कि जब एनजाइटी होती है तो हमारा ब्रीदिंग पैटर्न चेंज होता है। सो हमारा जब ब्रीदिंग पैटर्न चेंज होता है हम उस ब्रीदिंग से वापस एनजाइटी सिम्टम्स को रिवर्स कर सकते हैं। सो प्राणायाम एंड these breathing techniques we used to do it together. I hope I have answered your question, sir. I would definitely share that in the group. Most welcome, sir. Thank you for listening and for being here.
Anyone else would like to ask anything? Any question? No one? Okay, fine. So it was pranayama,
Yes,
right?
ma'am. Hmm.
What you did, the fast breathing and then inhaling, kind of
Yes,
along below and all, right? Yeah.
yes.
Okay, okay. And I just would like to know that when you did ego state, fear was the only factor
Hmm.
which was, figured out or which actively worked in that session in ego
Yes,
state.
ma'am. Yes, ma'am. Because as reported by her, उसके पहले वो अकेले उन्होंने सब कुछ मैनेज किया है तो कभी उनको ये चीज़ नहीं आई। पर कोविड के टाइम पे क्योंकि हर जगह अनसर्टेनिटी थी रिगार्डिंग हेल्थ एंड एवरीथिंग, सो वहाँ से द फियर एक्चुअली इट टुक बर्थ। मैम, यू आर नॉट
Yeah.
ऑडिबल।
Anyone else? Okay, so Mishti, it was really very nice work, I'll say. Presentation to acha tha hi. It's a very detailed work you have done, and very systematic work, and use of hypnotherapy was, the way you have worked or used the hypnotherapy was also, in a very systematic way. ऐसा नहीं है कि बीच में से ये कर दिया वो कर दिया. Appropriately it was used, and many congratulations to you.
It was all your guidance
It's
and
a
support.
very nice presentation. Very nice presentation.
Thank you,
Good
ma'am.
work.
Thank you. It means a lot.
Thank you. Thank you. And please inspire your classmates also to come forward and present the cases, because this platform is for us. Every session, I mean, every meet, I say this. There is a lot of learning when we listen to such cases. There's a lot of learning for everyone. So I once again ask and request everyone to please come up with the cases and share your knowledge and experiences. And even if you have any article, if you have written or you have come across, please share that article. Also, you can come and talk about that article also. So thank you so much. Thank you, everyone. Take
Thank
care.
you,
Mishti, thank you once again. Bye.
ma'am. Thank you.
Take care.
Bye. Good night. Ma'am, I I think I have missed few details also. I will share in the whatever breathing techniques I have used, I'll definitely share in the group. I have used references from YouTube, some of were from Instagram and from like where I'm working right now. So there also we use breathing technique. So I'll share that in the group. Okay. और मैं पेन मैनेजमेंट भी मैंने किया था, मैं वो इंक्लूड करना भूल गई। मैम आपका वॉइस ऑडिबल नहीं है।
Yeah. You can share whatever you just mentioned,
यस यस
right?
ओके, थैंक यू मैम।